This dental phobic patient was referred to me for endodontic retreatment of tooth number 30. According to the patient, the root canal was done by her previous general dentist about 3 years ago, along with a porcelain crown. And patient claims that she remembers that the dentist who did the root canal had a very hard time with the root canal, was very frustrated, and a few times even mentioned that the tooth was bleeding a lot. So anyways, and that's the root canal. As you can see a large periapical relucency right there. That's a large periapical relucency associated with the tooth. So as I said, patient had dental phobia, so we had to IV sedate her today. We talk about options with the patient, of course, before we even put a drill on the tooth. We talked about redoing the root canal. We would have to sedate her, of course, IV sedation, go through the crown, so she would need a new crown, and redo the root canal with guarded prognosis. As I always tell my patients, no promise or guarantees. I'll do my best. Only time will tell. I can redo the root canal and come back and see me in a few months. This periapical relucency should be getting smaller. If it's not getting smaller, then you have two options: redo the root canal again, or you can have the tooth extracted. For these areas, I really don't recommend apical. Apical in these areas is very challenging, very difficult. Patient would be better off if it gets to the apical. Patient would be better off just extracting the tooth and getting a dental implant. Usually the success rate for endodontic retreatment with a periapical relucency like this on an abscess tooth is about 70 to 80%. So 70 to 80% of the time the root canal is successful. About 20 to 30% of the time the root canal is not successful, and we would have to redo it if the patient agrees. If the patient doesn't agree at the time, then extraction would be the next option. But I always go over all of this with my patients, so there are no surprises. So today went ahead and IV sedated her and went through the porcelain crown, removed the buildup, and noticed there was a lot of clotted blood right under the buildup material, and there was tons of contaminations that told me that the patient's story checked out when patient was saying that there was a lot of bleeding. That meant that the pulp tissue was bleeding, and this dentist didn't really know how to manage that. And as you can see, didn't instrument all the way. He got freaked out, panicked, and right there you can see he left necrotic tissue, contamination, bacteria, what have you behind. So removed all the gutta-percha, was able to regain patency in all three canals, and we were able to redo this root canal, of course, in one appointment. And take a look. Here's one angulation. Again, you can see that we're able to regain patency in all three canals. This is one angulation. As you can see, everything went beautifully. Three-dimensionally instrumented, irrigated, activated, and obturated. Look at another angulation. In the other angulation, you can see something really nice. In this angulation, you can see this nice lateral right there, right into the lesion there. And here in this angulation, you can see again that nice lateral right into that lesion, that lateral lesion there. Yeah, so everything went great, as you can see. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration.